Okay.
Go ahead.
Hi, Mr. Smith. My name is Deanna. I'm going to be your student nurse today. Can I get your name and date of birth, please?
Bill Smith, 12XX.
Thank you. And do you know what day of the week it is?
Thursday.
And where are you?
Hospital.
Okay, fantastic. ANO times 4. And I've noticed here that you've been having some abdominal pain, so we're going to do an assessment for that. And have you been experiencing any dizziness or confusion?
No.
And have you had any headaches or vision changes?
No.
Okay, perfect. I asked those questions to make sure that my patient's not having any potential electrolyte imbalances or anything like that, or anything wrong with neuro. I would also go ahead and take the vitals of my patient to assess for any infections, which would be like an elevated temperature. I would take vitals to also assess for dehydration, which would be low blood pressure. And things like that. And so as I'm taking the vitals, I'm noticing that my patient's skin color is not yellow or jaundice or anything like that. And then after I would do the vitals, I would go ahead and move on into the some further questioning. So I would ask my patient if they're experiencing any pain. And because my patient has pancreatitis, they most likely will tell me that there's pain in their upper abdomen that kind of radiates towards the back, and possibly most likely gets aggravated when they eat fatty foods. I would ask my patient, have they been experiencing any nausea and vomiting? Most likely yes. They would be experiencing some nausea and vomiting as well. And then I would ask about their stools or their voiding habits. And so I would ask if they had any greasy or oily stools, as that is one of the telltale signs of pancreatitis, as described earlier in the instructional video portion and the educational portion, that when the pancreas isn't working as well, it doesn't digest the fats as well, so it comes out in stool. It makes it look greasy and oily. And then I would also ask if my patients experienced any fatigue or rapid weight loss recently, as those can be signs and symptoms of pancreatitis as well. And then after asking those questions, I would also, I would start to go ahead and inspect my patient, the abdomen, because I've already gotten the overall neuro assessment for my patient. So I would lay my patient back. Okay, as flat as this bed will go. And I'm going to go ahead and inspect the patient. And so in doing so, I'm going to make sure to actually lift up the gown and inspect the abdomen, as I want to make sure that there's nothing there that I'm missing, while still maintaining, you know, their modesty and stuff. So I'm looking at the patient and I'm inspecting, and I'm noticing, usually if they have pancreatitis, I would probably notice a little bit of distension or roundness in the abdomen. And I'm also looking for any tubes, drains, Foley catheters, anything like that. Now, I'm not seeing that on this patient currently. So after I would do the inspection, I would go ahead and auscultate and listen to all 4 quadrants, starting at the right lower quadrant and moving my way around clockwise. So I'm going to go ahead and do that.
I know. I just feel like when we start, it's going to be like boom, 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 boom.
Okay, and if my patient was experiencing pancreatitis, there's actually someone with pancreatitis can experience all 3 sounds. So typically it's more hypoactive in more severe cases of pancreatitis, but you can also have normal active, and then in some rare cases you can have hyperactive if they're experiencing any diarrhea or obviously quick bowel movements and things like that. So after the auscultation portion, I would go ahead and percuss, starting again in the right lower quadrant and moving around as so. And I would be doing the percussion and listening for any dullness or hyperresonance. I would hear dullness if there was a fluid buildup, and I would hear hyperresonance if there was any gassy, excess gas in the belly as well. And then after the percussion, I would go ahead and palpate again, right lower quadrant and in the same direction. And I would ask if they're experiencing any tenderness in that area. And as I'm palpating, most likely they would have some tenderness, especially in the upper quadrants. But as I'm palpating, I would do rebound tenderness as well, where I kind of at a 90 degrees, push down a little bit and then quickly release. And a patient with pancreatitis would most likely experience some rebound tenderness from that movement. And then so that would actually conclude my assessment for my patient with pancreatitis, and with all of those findings, it would confirm that my patient, not that I can do that, but it does look like that there's a lot of signs and symptoms of pancreatitis in my patient.